Hey everyone, Luke here, and today we're talking about a question that I hear quite a lot in the clinic, almost on a weekly basis. And it's one of those questions where it sounds like a pretty simple question, but the answer can be tricky depending on the body part you have involved or the potential structures involved and things like that. So the question, as you know now, is do I need an MRI? And this question comes again in all kind of shapes and sizes, and it could be related to things like your neck, or your back, or your shoulder, or your knee, or a hip, or any number of other body parts. So the answer varies quite a bit, and I thought with the video this would be a good opportunity to just go into some specific details and some specific body parts. So kind of bear with me here, and I'll get around to some other examples as we go along. So probably the most common time I hear this question is for lower back pain. And it's common because in the lower back, a lot of folks will come in with an x-ray, and the x-ray will show you pretty good clear images on things like your bones and your joints, and as well as like the disc space, so like the height of the discs between the two bones or three bones or whatever it may be. So you can get some good information on an x-ray in terms of if you have things like degenerative changes. It could be arthritic changes, shrinking in your discs, which is like degenerative disc disease, stuff like that. But if you think you have something like, let's say, a bulging disc that's putting pressure on a nerve, you can't really see that on an x-ray. So then folks say, well, gosh, if I can't see it on an x-ray and I can see it on an MRI, which you can, let's get an MRI and see what's really going on here. And it's understandable to kind of jump to that line of thinking where it's like, well, let's get an MRI to see. But stop just for a second and consider a few following points. So first off, if you have a bulging disc, let's say in your spine, it's pretty easy for us to figure out if that bulging disc, if it's there, is causing pain that's causing like a sciatic type nerve pain. So it's pretty easy for us clinically just to run a couple, simple tests, have you go through a few movements and say, okay, yes, you do have a bulging disc and it is putting pressure on your nerve, or no, most likely there's something else putting pressure on your nerve, like a degenerative change or something like that. So pretty easy for us to figure that out. Second, even if you do have a bulging disc in your back that's putting pressure on a nerve, the majority of these bulging discs are treatable, meaning you're never going to need something like injections or surgery. So at that point, it's like, well, do you need an MRI to know that? Probably not. So the majority of times I'm answering this question to people, the answer is no, you don't need an MRI, or at least not yet. So again, it's easier for us to figure out what's going on. Most of these things are treatable, especially if you're being proactive and not letting them sit for 2 or 3 years, which isn't always the case, but hopefully it is for you. And third, even if you have some damage to a structure like a bulging disc, if we're able to get rid of your pain and you're able to get back to the activities that it was stopping you from doing, like hiking, running, walking, getting up and down from the floor, bending over, things like that, there's no real need for you to get that much closer to surgery. The average person, if they get to the point where they're needing an MRI, they're getting closer to needing surgery, basically. Because if you think you have structural damage that's going to show up on an MRI and you haven't responded to conservative treatment like physical therapy or chiropractic or something like that, then you're getting closer to saying, well, what's your next option? Injections, surgery, things like that. So, save the MRI for if you are getting closer down those pathways. That's my advice, at least. So again, that's the most common one I see is for the back, and I hope that makes pretty good sense. So the other probably most common one I see is for the shoulder. And actually, before I go into the shoulder, the neck is kind of following the same thing with the back. So again, you follow the same kind of line of thinking. Is it structural damage? Can it, even if it is structurally damaged, can it be fixed to the point where I can still have no pain and do my full activities and not require surgery? So follow the same line of thinking for the neck. So behind those ones, the shoulder is the most common we see after that. So the shoulder, a lot of times people are saying, well, again, I had an x-ray, the bones all look fine, there's no fractures or anything, which is pretty normal, or there's some minimal changing that wouldn't cause the pain, but I think I have a tear in my rotator cuff. So that's one of the small muscles in the shoulder. So that's a common one. And they say, okay, well, if you wanted to jump ahead, you say, well, if I have a tear, I need to see it. I need to get an MRI. But again, let's follow that same line of thinking. Is like, no, you may not need an MRI unless there's enough structural damage that might require surgery. So go back to the beginning. It's like, okay, well, chances are we can pretty easily tell you if you have a big tear in your rotator cuff just by a few simple tests in the clinic. So if that's the case, we're happy to steer you towards an MRI if that's what we think you need. Second, though, a small rotator cuff tear is fairly common and usually isn't going to require any surgery. So the majority of these folks are able to, again, experience pain relief and get back to the activities that they like to do, which with the shoulder might be like reaching, lifting, carrying a kid, throwing a ball, whatever it might be, golfing for some people. So the majority of folks can get back to all that stuff without ever needing any other more invasive intervention like an injection or surgery. So they go through physical therapy and we work on things like that. And again, if you get down to the end of this kind of decision-making process, if you think or you haven't responded to conservative treatment and you think there's enough structural damage that you're going to need surgery, figure that out as quickly as you can, and then you move towards the MRI, and then you move towards surgery. So again, I hope that makes sense. I think some people just want to know. They just need to know, is it a tear? Is it a bulging disc? Is it, any number of these things? I just need to know. But again, if you're not that type of a person, which I'm not really that type of a person, as you can tell, it's like, well, what you need to know is, can I get rid of this? Can I feel better and do the things I want to do without requiring surgery? And if the answers to those two questions are yes, great, go on with life. And if the answer is no, and you've tried some things to get some relief and it just hasn't worked, then you say, okay, well, let's take a closer look. Maybe we do need an MRI. Maybe you are actually a candidate for surgery, unfortunately. But that's just something you need to make quickly. So my last piece of advice then for this type of a situation, if you think you need an MRI, is just do these things quickly. Don't wait around and see if your pain is just going to go away on its own, because lo and behold, it doesn't. Typically. And if you think you might need an MRI or surgery, get in to see your physician or your physical therapist or both quickly and get some expert advice on that kind of stuff. So say, look, come to someone like at our clinic for a PT and say, look, I got my referral. I'm here for my shoulder pain or my back pain. Here's what's going on. Do you think I need an MRI? Just get that input. And then hopefully if the input is like, well, hopefully not, we're going to get you better. Or if we can't get you better quickly, then we'll look at that. Then again, just speed up the process. So again, that's kind of the last point I want to make, is that if you do have structural damage, especially if you have something like a bulging disc putting pressure on a nerve, you need to get on top of that as quickly as possible. And if you do need an MRI, that is what it is. Answer the question as quickly as possible so that any of that structural damage can be fixed and minimize any permanent long-lasting damage. So there you go. Again, short question leading to over 7-minute answer, but I hope that helps you put things in perspective. And if you have any other questions on things like needing an MRI or getting to the root cause of pain, things like that, feel free to reach out to me at any time. I'll leave my information below the video. So thank you for watching. Have a good day.